call him and tell him that
First
we
of
weren't
all,
being rude. Okay?
thank you for coming. Okay, this mental health issues, depression, and mood disorders, schizophrenia, bipolar, they're all very, very complicated medical conditions. Okay, and if you expect one modality will cure all the problems, solve all the problems, I think it is really unrealistic expectations. But the science, technology keeps developing the best they can to help people. So as soon as the TMS come out, anything that is a non-drug therapy that has no obvious side effects, I'm all for it. So we got the machine as soon as it came out, the FDA approved. So we're the first office that have used TMS for people with depression. Even then, we have had a lot of success with the people with depression. We do recognize a lot of other factors are important. So we incorporate nutritional counseling, lifestyle counseling, some psychotherapy, and we definitely managing the medication. And also we do acupuncture, which is another way to support the system to kind of adjust, heal itself. So in our population, when we were treating people with TMS, they normally not just get a TMS, they get additional support. And the reason we joined the contemporary is really for two reasons. One is we want help as many people as possible. And through insurance, which they had a capacity experience of doing that, we're definitely going to help a lot of people, not necessarily having any financial advantage, but definitely going to help more people. The second thing is we'll have access to a lot more new research data and a protocol that are treating some very difficult condition in addition to depression, like Parkinson's disease, migraines, PTSD, eating disorders, and so on and so forth, and chronic pain. So that's definitely going to expand the use of the TMS, help more people. And your question is a really good question because we recognize a lot of mental illness chronically is also like the physical illness. They're epigenetic. There's a genetic foundation there. There's environmental factors there. So the one thing we do here, in addition to TMS, is called advanced nutrient therapy, or I call it a psychonutrient therapy now. It is really recognized 5 common underlying biochemical imbalance that cause behavioral thoughts and mood disorders. And then we do simple blood work, and we identify them, and we put them on the compounding nutrients and treating them for a few months to a year. And we help them a lot. Again, does that solve all the problem? No. Only 38% of the depression is the unmethylated, which is epigenetic problem. There's another 28% was overmethylated. If you give them SSRI, they're the one going to kill themselves. Okay, so that's why all the medicine has a black box, and that's because there's such a population there. But now we have a way to identify them to avoid that problem. And there's an overload of copper. There's a zinc deficiency. On top of that, there's other conditions like everybody began to recognize. If your gut is off balance, it affects your brain. So there's many factors are involved in the depression. But TMS as one of the treatment that generates a very immediate response and directly reprogram or reactivate the part of the brain that regulates your mood is definitely a lot better alternative than long-term use of medicine. And if we can fix other part of the other contributors, okay, to depression, definitely people's chance of lowering their medication or discontinuing the medication will significantly increase. So, and this is what we call integrative psychiatry. It's not just one thing. So TMS is a wonderful tool, and we really want people to take advantage of that since the insurance company covers it. Definitely, we can do a lot more than just the TMS for people who come here.
And the